It is really important when you do decide to have any aesthetic treatments done that you're going to the right people. And of course, doctors are really important when you're getting, whether it's fillers or other treatments like Sculptra.
Yeah, so I think to the first part of your question, we're big advocates of what we call the medical model. And that is that if you are going to have an aesthetic procedure, just ensure you're going to a medical professional. We all like deals, we all like to save money. Savings in your face are not two things that should go together. So that's probably the first piece with it. In terms of the treatments with it, there's lots of different types of treatments. You have the use of things like dermal fillers with it, which we tend to use in a very anatomical, very natural way. So for those of you that are worried about the chipmunk or the hamster cheek look with it, it's not an aesthetic that we ever kind of go for. So Sculptra basically will increase your collagen production by convincing the fibroblast, which is the guy that makes collagen and elastin, that he or she is a younger fibroblast. So in the first about 3.5 months, your collagen production increases by about 70%. It's a treatment that lasts about 2.5 years, and the maintenance of it is really low. I was talking to somebody earlier, and we use a lot of it in what we call a lifting protocol, what we call a ponytail lift, where we can put it into your temporal areas and into the actual scalp line, and it causes the ligaments behind here to tighten up. For a lot of women, this, or your pre-jowl, the lower neck, tends to be a little bit problematic, and Susanna knows this, that sometimes people can walk in and they'll just take one finger, and they're just like, if you can just do that, I'll be happy. So it's a treatment that's becoming ever popular, and it's not a filler.
Susanna, of course we're hearing about these new polynucleotides and skin boosters.
So I would say they're one of the latest trends, and they're extremely popular. We're all seeing them on Instagram, we're aware of them. Some people, when they hear filler, they have this preconceived conception that it's going to really change their face, and some people like something more natural. So it's salmon DNA, it's injected into an area. You can do it full face, it can be area specific, and what it is doing is reprogramming your DNA into the area that you're building a secondary layer in that area. So it's really for fine, crepey skin is the main thing we're targeting. Be it the neck, be it the under eyes, they're one of the most popular areas around the cheek. It's all area specific.
The way I simply describe it to people is Profilo is hyaluronic acid. It's very important for hydration, for giving the skin a kind of dewy complexion. You don't look different, you look better. I don't wear makeup, but obviously I hear from lots of friends of mine that do, and even my fiance and my sister and my mum, that often it'll sit very differently on the skin. So for example, from a foundation perspective coverage, you'll probably end up using something a little less dense, a little less heavy. Polynucleotides then are very effective towards elastin production. So I always say to people, if you imagine the chicken skin area in your face, so a lot of the times people come in, they grab their neck, they grab their under eye area. I think it's very useful for those types of areas with it. And again, to Susanna's point, the big thing is these are regenerative treatments. The whole aesthetic space is going towards regenerative side. So that means we can do things earlier, get the tissues engaged, basically get them to produce a little bit more of what they were doing when you were younger.